Good morning, everybody, and many thanks for taking the time to be here today. I'm really pleased to be here to speak at the Mental Health Commission's launch of both their Strategic Plan 2023 to 2027 and the revised National Quality Framework for Mental Health Services in Ireland. Firstly, I would like to thank Dr. John Hillary, the Chairperson of the Mental Health Commission, for his kind invitation and to acknowledge the work of the staff and the leadership of the Mental Health Commission in the design and build of this plan and framework. I am pleased to be speaking alongside members of the Commission's executive team today, and I want to thank John Farley, the Chief Executive. I want to genuinely thank Dr. Susan Finnerty for her tireless work. And you have been so busy over the past 12 months, and I just want to say thank you for all you do. And I want to thank the entire executive team, including Gary, Kieran, for their ongoing leadership of the Commission. And I would like to take this opportunity to acknowledge the Mental Health Commission's important and independent role in supporting the development of mental health services in Ireland. Looking first to the Supporting Change Strategic Plan 23 to 27, I welcome the vision expressed in this plan of a person-centred, high-quality mental health service accessible to those who need it on an equitable basis. I am pleased to see also the focus of the Mental Health Commission on the human rights aspect of the people who use our mental health services, including those who may need support with decision-making. This is most certainly an ambitious plan, but knowing the people involved in Mental Health Commission and their commitment, I have no doubt it can be achieved, and I wouldn't expect anything less. I note and welcome that your core objectives is to drive standards, improve quality and safeguard persons by working with all stakeholders. I suppose what you're really saying is you're putting the service user front and centre as per our mental health policy sharing the vision. The set-up and operationalisation of the Decision Support Centre too, as far as possible, maximise autonomy for individuals who require support to make decisions about matters such as their personal welfare. Their property or their financial affairs is hugely important, as is the monitoring and supervision of those who provide such supports. And we know this policy will be coming in on the 26th of April. It's a hugely important policy, those for people with mental health challenges, especially for people who suffer with cognitive impairment. I dealt with a case only 2 weeks ago of a lady who had dementia, and she had a gynae issue, and she was in University Hospital Waterford, and a simple procedure was not allowed to proceed because she wasn't in a position to give consent herself, and the family's consent wasn't acknowledged. And that particular lady was returned home into a nursing home, and she still has a simple gynecological problem that hasn't been resolved, so it can't come soon enough. The value of the work carried out by the Mental Health Commission is related to approved centres must also be acknowledged. Centres registrations, regulation, monitoring and enforcement, inspections, reporting, and the establishment and operation of mental health tribunals for those involuntarily detained are of benefit for those who use mental health services, their families and loved ones. And in my role as Minister for both mental health and older people, we often hear, and I actually only heard it again yesterday, in relation to nursing homes and not nice comments in relation to the role of HICWA, and we often hear nice comments in relation to the role of the Mental Health Commission. But can I just assure you all that I will never compromise on standards. We never want to see a situation arrive where a person isn't safe in an approved centre. And I will be working, as well as the Act this year, enabling those to go into, the community homes that wasn't, we weren't able to do that previously. And it's the same in relation to nursing homes and in relation to HICWA. So while I'm standing up here, I will never compromise on standards. The work benefits those working in this area through the guidance available from clearly set out standards, and this strategic plan refers to the continuous improvements of services. The independent work of the Mental Health Commission, particularly in the areas of reporting and standards development, is an important contribution to our objective of providing timely, high-quality mental health services for adults, adolescents and children. As you know, the Government is committed to a high quality, safe and compassionate mental health service for adults, adolescents and children. The clear commitment for enhancing mental health supports is shown by the significant increase in funding for mental health services in recent years, with a record budget of 1.2 billion for mental health services allocated in budget 2023. And I have to say this represents a 20% increase over the last 3 years, 3 hard-won budgets, an increase of 20%, but I want to do so much more, and I will do more in budget 24. The funding is crucial for continued implementation of Sharing the Vision, our national mental health policy, and Connecting for Life, Ireland's national strategy to reduce suicide. In addition to ongoing and increased funding for mental health services, a focus on service improvement and reform is essential. We have and will encounter challenges along the way. We need to promote quality and safety in light of increasing demand and case complexity. I want to assure you all that I will continue to work to champion the change and improvements that patients need to see. Later this week, I will start a series of roundtable discussions in relation to CAMS. So there's going to be 3 over the next 3 weeks, every Thursday for the next 3 weeks. And I think it's really important to acknowledge all the really good work that's done on the ground in relation to mental health, and to thank all those who provide services to support the most vulnerable in society. Progress has been made. Sharing the Vision aims to enhance mental health services and supports up to 2030 and ranges from mental health promotion, prevention and early intervention to acute and specialist mental health service delivery. It places the individual at the heart of the service delivery and contains 100 recommendations for services to address and accommodate the specific need of individual service users. The National Implementation Monitoring Committee has responsibility for monitoring the implementation of the policy recommendations, and I am pleased to advise that as of Q4 2022, 87 of the 100 actions are in implementation, with 57 marked on track. So we have more to do, but we have made a really good start. Mental health sits in the much broader context of how society views mental health and how decisions are made across the spectrum of relevant public services to invest in the well-being of the population and support individuals living with mental health difficulties in their recovery. And I suppose that's what I say every time I stand up on a podium to talk about mental health challenges, people living with acute mental health. But recovery is always possible, and I do think it's really important that we give people hope. Good mental health for the population of Ireland cannot be achieved without measures being taken by many, including the Department of Health, other government departments, the HSE and partners, and indeed the Mental Health Commission, all working together. The strategy of the Mental Health Commission aligns with Sharing the Vision and is an excellent example of how strategy can help guide us to achieve our goal of a high-quality, supportive, person-centred mental health service accessible to all. Turning now to 2023 National Quality Framework for the Mental Health Services, I would like to commend all those involved in the development of this framework. The considerable effort that has gone into the development of the 2023 framework is clear to see. I welcome the extensive research carried out by the Mental Health Commission in conjunction with the RCSI, and I note the levels of engagement that the Commission has had with a variety of stakeholders, which led to the development of this framework, which is set out as a clear, modern, rights-focused document. I note that this framework will apply to all mental health services in the public, voluntary and independent sectors, including inpatient mental health services, community mental health services and community residences. And I'm very conscious of the many community residences that we have, the length and breadth of the country, where we don't have oversight. And I do think it's really, really important that we make this step change this year under the legislation. I note also the National Quality Framework applies to mental health services for children and adolescents, adults, older persons, persons with an intellectual disability and a mental illness, and forensic mental health service users. Aligned to the strategy of the Mental Health Commission, it is evident that the voluntary framework has been developed to drive high standards, provide clear guidance, support continuous improvement, and support quality, recovery-orientated mental health services in Ireland. I and the Department of Health, and I want to thank my team that are with me today, particularly welcome the role that the framework will play in the delivery of the recommendation of sharing the vision, particularly recommendations 83 and 4. This is a modern document and approach as evidenced by the updated 8 themes spanning the framework, the increased focus on governance and the targeted standards and criteria for specific services. I am pleased to see that the framework designed in this way will move in step with the implementation of sharing the vision. The digital self-assessment tool also holds the potential for providing important help and guidance for providers seeking to drive service improvements. This framework will play an important role in the measurement and monitoring of desired standards and practices in mental health care in Ireland. The shift towards a more person-centred, rights-based approach to mental health will be evidenced in the upcoming Mental Health Bill. And I would like to thank the Commission for its input to the process to date and its ongoing engagement with the Department during the drafting process. The Mental Health Commission will play an even more significant role in the regulation of mental health services with the expansion of its regulatory remit to include all community services in the new bill. I am pleased to say that the bill has received priority drafting and the Department officials are working tirelessly and intensively with parliamentary drafters to ready this complex, lengthy bill. There's currently 2 parliamentary drafters working on the bill, and I want to thank James sitting down there who has worked on the bill for the last 2.5 years, and it's just, it's at this stage now, James, I feel that you are just buried in that bill, and I am really looking forward to getting it into the Oireachtas as soon as possible. I am planning to introduce it as soon as possible after drafting concludes later this year. There's about 140 different heads in the bill, and every time, we have a head just more or less concluded, the Attorney General's office comes back looking for further clarifications, and every time we have to look for further clarifications, it delays it every time, but we do want to get it right. And I think this is a step change. It's an opportunity to have this piece of legislation right, and I think people with mental health illness, people with mental health difficulties, people with mental health challenges, they deserve that. So it is frustrating at times that, sometimes people might say, why is it taking so long? But it's probably the most complex piece of legislation that will ever come before the Oireachtas. Ahead of the launch of the Decision Support Service next week, I would like to take the opportunity to acknowledge the tireless work that has gone on behind the scenes to commence the Assisted Decision-Making Capacity Acts and to operationalise the Decision Support Services. I want to wish the Mental Health Commission, Anya Flynn, in her role as Director, and all of the staff involved, my sincerest best wishes in the months and years ahead. Finally, I want to commend again the work of everyone who has contributed to the development of the new strategic plan and the National Quality Framework for Mental Health Services. It involved an enormous amount of work and dedication on your behalf. So thank you again for your hard work, because many people will benefit from this. So thank you, and I hope you enjoy the remainder of today's events and the remainder of the speeches. Gaurav Mila Mahagov.